let's just give a quick overview of infections. So maybe get some information that you can think about and share with your physicians. Because, again, we're trained to look for acute infections. Chronic infections, other than tuberculosis and maybe leprosy and a few, and in the past, hepatitis C, are not something that occupy the mainstream of medical thinking. Okay. And what we haven't understood is how many infections are just bugs that have co-evolved with us. When you think of the viruses, they all have co-evolved with us, but especially things like the DNA viruses, which are the herpes family is a big one that we all know about, the Epstein Barr. Some of you might know about HH6, which has been implicated also with Epstein Barr in some cases of chronic fatigue, and of course the herpes simplex. These are viruses that actually, once they get into our system, they keep living on inside of our B cells, part of our own immune system. Now, they're dormant in there most of the time, but when your system gets stressed and those B cells reproduce, they sometimes reproduce some of those, some of the genes of the virus reproduce, and they produce proteins that irritate the immune system. And so it's a constant upregulation. And this can lead to chronic illness. Now, if you've been following it, it's one of the things that has been implicated in MS. We've often suspected that there was a chronic infection underneath it, but multiple sclerosis is something where the data is looking pretty strong that, again, not every case, but that Epstein Barr may in fact be one of the triggers to develop MS. And then we have the tick-borne diseases, and this is, I think, even probably more important and less recognized in the mainstream. Most doctors act as though if you had a tick bite, then well, sometimes you just give you a day of antibiotics, say, oh, you're fine, which was based on a terrible study, and it doesn't work. But, if you've been treated with 3 to 6 weeks of oral antibiotics, you are cured. And there's no question about that. Done. If you have anything that persists, you have post Lyme. And anyways, so we're not going to argue the post Lyme or not, but just to understand that other things are happening. These are bugs that also have been with us for a long time. Your immune system is able to suppress them and keep them in check until you get a big enough load. And just as Dr. Parpy was talking about, those other things, the toxins and life stresses, probably the biggest ones amongst them, or another infection, as we saw with COVID.